Hi, this is Dr. Bharadwaz. I am CEO and Chief Doctor at Fidicus Homeopathy. Today we will discuss on one of the rare diseases known as multiple sclerosis. The problem with this disease is it's a recurring disease and it happens in the middle age group. It happens mostly between the age group of 20 years and 40 or 50 years. The main challenge the patients are going to see here is dependency. So this is the age where between 20 and 50 where we are powerful, where every human being wants to be powerful, where every human being wants to be independent of others. He doesn't want to depend on others. He want to build his own empire, or he want to support his family. At this point in time, what happens exactly here is he will be dependent on others because of this disease. So it is not a life threatening disease at this age, or at least initially, but the main challenge, or whenever I get the patient, they say that, sir, we want to be independent. We are so depressed that we are dependent on other person rather than helping our family. We are dependent on them. That's the main challenge these guys face, and they need a lot of support from the family here as well. But the good news is, with homeopathic treatment, you can live independently without symptoms, or you can reduce the intensity of the symptoms, frequency of the symptoms, and duration of the symptoms. You can live independently, healthily, without single side effect. And also the homeopathic treatment is very efficient and safe compared to any other treatment for multiple sclerosis. And we will now check how it happens, how homeopathy can help, and what are the important things you need to learn and you need to understand about multiple sclerosis, so that you can live your life independently and successfully you can lead your life. Coming to the statistics, it's a rare disease and it happens in 0.5% of the population. What it means is, so out of every 200 people, one person might develop multiple sclerosis, and it develops maximum at the age of 20 years to 40 years. 20 years and 40 years is the age group where the maximum cases are seen, and it's the disease of women predominantly. 3 is to 1. If 3 women are suffering, only one among them is men. It is mostly gender based and high in women as well. Basically, this is the inflammation of the brain or degeneration of the brain. It's an autoimmune condition. What I mean by autoimmune condition is, normally whenever a bacteria or virus comes into your body, your immune system has to fight against that and kill it. In this scenario, what happens is there will be a protective sheath around the nerve cell. So that protective sheath is known as myelin sheath, and that sheath is destroyed due to autoimmune activity, or immune cells of the patient destroying the healthy cells of the patient. Because of this, there will be death of nerve cells and degeneration of the brain and spinal cord, and there will be blockage of signals, blockage of nerve transmission, or there will be weakening of nerve transmission or slowing of nerve transmission. That is the main problem we have to see in this disease. And coming to the symptoms, it is very important for you to understand the symptoms so that you will not be in panic about it. And the first thing is, it happens in episodes. Normally the symptoms will develop in 24 hours or 48 hours. It lasts for few days to few weeks. After that, the patient will slowly recover and sometimes become absolutely normal. Sometimes he may not be becoming normal, but he will have mild symptoms, but it will be reoccurrence. This will happen throughout his lifespan. This is one of the characteristic symptoms of multiple sclerosis. And coming to other symptoms, first one is general fatigue. These people feel very low or very depressed, or they feel low energy, or they will feel weak during the episodes. Next one is visual disturbances. They can have sometimes blurriness of vision, or sometimes they can have complete blindness. There will be abnormal sensations like pricking sensation, crawling sensation, numbness, tingling, pain, paresthesia. A lot of symptoms can be associated, or a lot of nerves related or skin related symptoms can be associated with these patients. They can be weakness of a particular muscle or a particular limb, or they can be paralysis. Sometimes there can be loss of balance while walking, standing, and sitting. There will be loss of coordination between hands and legs, or between two hands, or between two legs. There will be walking difficulties. They can be imbalance while walking, and also they can be speech problems like slurring of speech, difficulty in speaking. Lot of symptoms are associated with it. And coming to psychological problems, they can be depression, they can be anxiety, and also they can be loss of memory. This loss of memory can be characteristic. Some people forget the things that have happened in the past, and some people have difficulty with the present memory or current memory as well. You have to understand these symptoms are not common, or these are highly variable. What I mean by this is, some people have some specific symptoms which other people will not have. If you want to understand the symptoms correctly, it is going to affect all the functions of nervous system. There are two types of nervous system: autonomic nervous system and somatosensory nervous system. In autonomic nervous system, the things that are hampered are involuntary actions, like your respiration, your reproductive system. Your reproduction libido is decreased, or you won't feel like having sexual activity, and also your respiration will have problems, your digestion will have problems. All the involuntary actions in the body will have problems because it affects autonomic nervous system. And also it affects somatosensory nervous system. Sensory nervous system means sensory organs like eyes, nose, tongue, skin, hearing. All these disturbances you will have because of this. And also motor system. Motor system means muscular actions. So walking, running, speaking, whatever, wherever you want to use the muscle, even that will have the problem. This is not a single set of symptoms. There is a huge list of symptoms. In each person, this manifestation can be different. Not only the manifestation, intensity of the symptoms, frequency of the symptoms, and duration of the symptoms also differ between the people and also within the same person during different episodes. Coming to the investigations, so MRI or CT scan will definitely diagnose this. What happens is, there will be some characteristic lesions within the brain and spinal cord for the patient suffering from this disease. And also nerve conduction test is very important to do, so that you can assess the amount of damage that has already done by this disease. The important thing here the patient has to understand is two things. One is normal anatomy and normal physiology. Normal understanding of this is very important for the patient. See, what exactly happens is, if you want to construct a house, you will be constructing the house with the set of bricks. So brick is the unit of construction of the house, right? In the same way, brain and spinal cord or nerves in the nervous system are made up of special cells known as neurons or nerve cells. These neurons or nerve cells are the building blocks of our nervous system. Every neuron has three parts. One is soma, it is the body of the neuron. One is dendron, which is short, and one is axon, which is small. So there are some variations depending on the what type of nervous system it is. Normally, it will have projections from the body. These projections, axons and dendrons, are surrounded by the Schwann cells. These are the protective cells of the nerve cell. You will have an axon. This axon is protected with a sheath. This sheath is made up of Schwann cells. So this is the protection of the axons. What is the importance of this protection? See, now nerve cell is a conduction cell. It will conduct the nerve impulses. While conducting the nerve impulses, these Schwann cells or protective myelin sheath ensures that the conduction is efficient. There are no blocks in it while conducting. So nerve cell and the axon of the nerve cell surrounded by myelin sheath is very important structure you have to remember. And coming to the etiology, what are the reasons or causes for this disease? First one is genetic. It has a strong genetic background. With the genetic, if any one of your family members have the multiple sclerosis, your incidence will be doubled. Means the risk factor is doubled than compared to the normal person. Next one is your lifestyle, especially your diet, your exercise, your sleep, your habits, and your stressless life. Very important factors that can trigger this disease. The next risk factor is other autoimmune disorders. If you have other autoimmune disorders like psoriasis or Hashimoto's hypothyroid, Crohn's disease or pernicious anemia or any other autoimmune disorder, you are at high risk of getting this multiple sclerosis as well. Other risk factor is infections. If you have viral infections or any other bacterial infections, especially Epstein-Barr virus is one of the virus that is responsible for triggering multiple sclerosis. Age is also a risk factor. If you are between 20 years of age and 40 years of age, you are at high risk of getting multiple sclerosis compared to other people. Vitamin D deficiency. So if you have vitamin D deficiency in your body, either you will have more risk of getting the disease or your symptoms will be more compared to the people who are having sufficient amounts of vitamin D. It is also the same condition is linked with the people who are living in the equatorial region. The people who are living in the equatorial region will have lesser instance of multiple sclerosis because they have more vitamin D than compared to the people who are living far away from the equatorial region. The people living in Scandinavian regions are at a high risk of getting multiple sclerosis because they will have low levels of vitamin D in their body. Next one, obesity. Obesity is one of the risk factors. If you are obese, your intensity of the symptoms will be more, frequency of the symptoms will be more, duration of the symptoms will be more, and also the risk of getting this disease or triggering this disease is high in obese people. And coming to the gender, if you are a woman, you are 3 times more prone to get this disease than compared to the men. So being women is one of the risk factors for this disease. Coming to the pathology of the disease, what happens exactly in the body of a person who is suffering from disease is very important for you to understand if you have this disease or your loved ones have this disease. Whenever there is foreign organism enters into your body, our immune system has to launch an attack on it and kill that foreign organism, whether it can be any protein, virus, bacteria, fungus, any infection that comes into your body has to be destroyed by our immune system. In this condition, what happens is our immune system recognizes the myelin sheath, the protective sheath around the axons of the nerve cell is going to be destroyed because our body identifies it as a foreign body and kills it. Over a period of time, what happens is all the myelin sheath is removed. As there is no protection for the nerve cell also will be destroyed or completely damaged or it disappears. So normally destroying or disappearing of nerve cells should happen with the progress of the age, but in this condition it happens in the younger age. One more pathology it establishes is whenever the myelin sheath is destroyed, our body tries to cover it again. So this covering again is of two types. One is regeneration and repair. In regeneration, entire new myelin sheath is produced, but in repair, instead of myelin sheath, there will be the formation of scar tissue. As there are multiple places this myelin sheath is destroyed, you will have multiple scar tissues in the brain and spinal cord. That's the reason it is known as multiple sclerosis. This is a characteristic symptom of multiple sclerosis where you can see multiple scars in the central nervous system, because the repair is more than regeneration. The regeneration is very less. That's the reason there is more scar tissue formation. Because of this scar tissue formation, two things will happen. One is there will be entire blockage of nerve impulse. Whenever the nerve impulse is traveling, there will be complete block, or the speed of the nerve impulse is decreased. These are the two effects that are produced due to multiple sclerosis. Coming to the conventional treatment is also known as allopathic treatment, western treatment, or English medicine. This is also the treatment where you go with a neurologist or a neurosurgeon and take the treatment, or the treatment at a corporate hospital or any doctor nearby you is known as conventional treatment. In conventional treatment, there is no cure for multiple sclerosis or there is no good treatment for multiple sclerosis. They will either use painkillers, most probably they will use steroids to reduce the immune system. Once you start using the steroids, you will be completely dependent on it and you will have a lot of side effects with the steroids. And also, once you start using the steroids, your immunity will be coming down and you will land into a lot of infections. That's the reason steroids are not good. And also you will be using lot of painkillers. You know that painkillers can have effect on your liver, your kidney, your nervous system, and it can damage your body very quickly. That's the reason there is no cure or there is no proper treatment for multiple sclerosis in this type of medicine. If you go with allopathic treatment, what happens is along with the symptoms of the disease, you have to endure the symptoms of the treatment as well, or the side effects of the treatment as well. So that's the reason we don't suggest you to go for allopathic treatment in this regard. And coming to homeopathic treatment is very good treatment in this case. What happens is with the usage of homeopathic treatment over a period of time, there two things can happen. It can improve the quality of the life, it can improve the quantity of the life. What I mean by quality of the life is you will reduce the intensity of the symptoms, you will reduce the duration of the symptoms, you will reduce the frequency of the symptoms. By this, the quality of your life is increased. There is no need for you to depend on other people at this young age. And also, it directly impacts your lifespan. Your lifespan will also be increased because of homeopathic treatment. All this is possible in homeopathy without single side effect. Homeopathy is safe, homeopathy is very effective compared to any other system of medicine. Homeopathy has the highest success rate for multiple sclerosis. Homeopathy is safe, homeopathy is effective, and homeopathy is timely. What I mean by timely is it can reduce the symptoms very quickly in time over a period of time. We have seen the cases where multiple sclerosis is completely cured. In some cases, not all cases, but in some cases we have seen. In most of the cases, it will relieve the symptoms. It will relieve the symptoms by decreasing the intensity, decreasing the frequency, and decreasing the duration of the symptoms. Compared to any other options, homeopathy is best for multiple sclerosis. Coming to precautions, precautions are very important for this disease. First one is disease modifying therapy. There are a lot of nerve symptoms associated with this disease. Depending on the symptoms, you have to go with the therapy. For example, you have speech problems. Getting a speech therapy is good. If you have imbalance in your body or lack of coordination in your body, there are certain therapies which can improve it. These are very important in this disease. And coming to the important precautions, there are 4 or 5 important precautions you have to follow. First one is diet. Diet is very important for you. Be on low carbohydrate diet, reduce the carbohydrate in your diet, and also reduce refined oils, and also reduce the oils with high omega-6 fatty acids. If you can do this, there will be a lot of improvement we have seen in this disease. Coming to the sleep, next, sleep is very important. If you are an adult, you have to have good sleep both in quality and quantity for at least 7 to 9 hours per day. Then the symptoms are going to be improved. Exercise is the most important thing you have to do in this disease. All kinds of exercises can be done: strengthening exercises, speed improvement exercises, power improvement exercises, hypertrophy exercises. And coming to the endurance part, muscular endurance exercises will help you. So mid duration endurance, long duration endurance, short duration endurance. Your exercise should be the combination of all of these, so that you are healthy in multiple sclerosis. And the most important of all is coming out of the habits. If you are a smoker, if you are an alcoholic, or if you have porn addiction, or if you have any other addiction, video game addiction, you have to come out of these addictions and you have to start your life fresh and healthy again. With these lifestyle modifications and homeopathic treatment, you have high chance to either cure or relieve your symptoms with homeopathic treatment. Fidicus Homeopathy is a chain of clinics located across the globe. We offer you 2 types of treatments. One is in-person treatment and online treatment. In in-person treatment, you can inquire about the nearest branch and you can physically come and take the treatment with us. And if you are anywhere in the world, you can be US, UK, France, Pakistan, anywhere in India, you can consult us through phone. We will arrange a video or audio call. If required, we will allow you to share the reports to us, and we will send the medicines to your doorsteps so that you can use from the comfort of your home itself. You have to consider Fidicus Homeopathy for multiple sclerosis because we have the highest success rate in case of multiple sclerosis than compared to any other individual homeopathic doctor or chain of clinics or corporate homeopathic clinic. We have the highest success rate because our doctors are the best and our medicines are the best. We only use good quality medicines, top quality medicines, and our doctors are also of top quality. They are qualified, they are experienced, they are passionate, and they are competent compared to any other homeopathic clinic. At Fidicus Homeopathy, you have the highest success, transparent treatment, and personal care. Thank you.
Fidicus Homeopathy.